Today we're here to talk about something that we consider extremely exciting at WashU through our Center for Diabetes Translation Research, and that is our new network with parents as teachers. I say new core in the CDTR with parents as teachers. And today we're going to be talking about advancing diabetes research through home visiting networks and talking about how this core can help do that, the intergenerational diabetes research via home visiting networks core. This is a really robust collaboration between WashU and parents as teachers.
And we are very excited to be able to do this. It's part of, we got to acknowledge our funder, which in this day and time is extremely important, which is NIDDK at NIH. Next slide. And this is a result of a 25+ year partnership that really represents a model academic community partnership with parents as teachers. With any number, I think we've had 8 or 9 R01s over the years and numerous studies, pilot studies that have helped other investigators begin work with maternal child health and prevention at a population level. This is just some of the studies that we have had the privilege of working with PAT on. And it's a wonderful organization really dedicated to parent-child health, family health, and does a great job as an infrastructure, in particular with reaching families in an evidence-based way so that we can translate research or translate the science we have in a way that works and has impact. Because as all of us know, we do some great work that stays behind the clinical walls. This is an infrastructure for really making it work within real-world practice and real-world settings. Next slide. So the agenda today is really talking about as I mentioned, the core partnership, but really handing this over to Allison and Karen at Parents as Teachers to talk about the model they have, their reach, their data, how investigators can engage with the PAT network, and then opening it up for questions and answers and talking a little bit about next steps and resources. Next slide. And so with that, I get off the stage and I'm going to turn it over to Allison.
Thanks so much, Deborah, and thanks everyone for joining today. We are so appreciative of our partnership with Deborah and team for many years. The science and practice together is so powerful, and we really see great movements in this work. And so excited to talk with you more about parents as teachers today. I'm the Senior Vice President, Chief Research Officer, and been with the organization for 11 years. And first, we want to start off with why home visiting and what it is and what it does. So we are partnering with families prenatal to kindergarten, and we know the first 3 years are really this peak period for brain growth and development and setting that foundation for health and lifelong learning with children. And so we equip parents with tools to nurture their child's cognitive, social, emotional, and physical development, and really support too the brain-body full connection and how environmental factors influence health and long-term well-being. We do this through our 2-generation approach of working with parents and children and the entire family and that whole family system. It's a prevention and early intervention model. So regular visits, which we'll talk a little bit more about the components. We meet with families and encourage connection to resources. And so really meeting them where they are early on. It is also a strategy to address social determinants of health. So home visiting bridges families and their essential supports and connects them to housing, food, transportation, education, and other systems that we know are critical in supporting families' health and well-being. And we are backed by decades of research, and not only the research that we've done with Deborah and team, but others as well. And so we'll briefly mention that later. So first, to kind of ground us to our organization vision and mission, we started here in St. Louis and scaled across the country and international. And our vision has always been that all children will develop, learn, and grow to realize their full potential. And we live that out through the mission of really supporting and engaging the parents and caregivers in the home. And you can see some of our organizational values about being responsive to communities, continuing to learn and grow, and relationships and integrity and accountability. reference some of our past work together through some NIH funding and other pilot projects. And in total, through Parents as Teachers history, we've been around for over 40 years. We have had 13 National Institutes of Health funded studies and from a range of institutions. And we have also had HHS, HRSA funded service support and Office of Adolescent Health. So 13, as well as those 2 additional federal grants. We've leveraged over $20 million in philanthropic donors over the last 10 years. Folks like Enterprise Mobility Foundation, Elevance Health Foundation, Bezos Family Foundation, Balmer, and many others referenced here. When we engage in with research partners, we've done things from longitudinal trials, like the work that Debra referenced, following families over time, embedding evidence-based practices and strategies within the model. We've done secondary data analysis studies. So these are things like we're going to talk about some of our data and what we have. And so diving into that on the maternal mental health side or postpartum care. And we also support rapid response for pilot projects. We have a network that we'll talk about that we can do rapid surveys to really kind of feed and inform future proposals or projects that you all might be working on. We have a range of research partners, and research has really become a kind of a core pillar partnership of ours over time. And so these are some of the research organizations we partner with. We value it so much. It brings credibility and specialized expertise to our work. We have 28 active research and learning projects underway right now, 6 of which are National Institutes of Health funded, and many others are funded by the philanthropic funding I just referenced. And the partnership projects span from anything to disseminating health and cardiovascular health content, to adapting health content for Abuja, Nigeria, focusing on reaching families in the prenatal and postpartum period, implementation in Indigenous communities, and continuing randomized control trials to maintain our well-supported evidence status. But yeah, these partnerships really accelerate us and help us with the pace of work, the quality, and relevance. Our overall reach, so we partner with 2,300 organizations across all 50 states, 3 territories, and 6 other countries. That's our network of professionals and organizations that are going in the homes and supporting families. Most commonly, we partner in research with our affiliates, who's our evidence-based home visiting network, which is about 1,000 organizations in the US. Services are delivered through 86 plus professionals, and the organizations can be in school districts, social service agencies, health departments, hospitals, military organizations, tribal organizations. We also have a partnership with 115 tribal communities. A really wide reach. Annually, you can see we're serving over nearly 225,000 children and over 180,000 families. So really wide reach, and almost 1.8 million visits are delivered. When we take a look at the families we serve, we believe in serving all families, and all families can benefit from support. And we know our program is voluntary, and we often see that families enroll have many stressors. So 82% of families enrolled have more than one stressor. Some of the common stressors are low income, young parent, substance use, parent with mental health concerns, disability or chronic health conditions, recent immigrant or refugee family, housing instability, history of child abuse, neglect, and so on. So many stressors that we know are really supporting families' overall health and well-being. We are reaching nearly 20% of our families are enrolling in that prenatal space. We know if we can reach families earlier, we can have a greater impact. So that is really exciting. And 49% of families have at least one child under the age of 1 that are enrolling. Just briefly to share a little bit more about the model components, we have 4 components that are interactive and work together, and we use a strength-based, relationship-centered approach to our work with families. We offer personal visits, and those are in-home or virtually, emphasizing parenting, child development, parent-child interaction, and things like health and nutrition and overall family well-being. We do collaborative goal setting with families. Another component is health and developmental screenings. So not only supporting the child in their development and early detection of delays or health concerns, but also the caregiver's overall health and well-being and the whole family's health. We connect families to resources in the communities. Their families, as you saw, had many stressors and so many social needs. And so connect them to shelters or mental health supports, food banks, diaper banks, and so many more. And then group connections. We offer group connections where families can come together to create that social connection, that shared social support, and that peer interaction. So really a space for creating and breaking down some of the isolation that can happen. I mentioned that we are backed by evidence, so we have 40 plus years of independent research. That's including 4 independent randomized controlled trials and 58 plus peer-reviewed studies. We are recognized on multiple US and international clearinghouses as being evidence-based. And we continue, as you heard, to engage in 28 research and learning projects ongoing. So we are continuing to build that and understand how we can continue to improve our model. So what's the National Center's role in research? We can really support all phases of research, from helping to shape questions, to thinking about methodology, to participation, criteria, recruiting, in the implementation phases, really bringing it in to think about how it can be embedded and sustained and scaled. Supporting interpreting of findings, dissemination, and ultimately translation into practice. So we really maintain an infrastructure to support these longitudinal trials or secondary data analysis, or even these kind of exploratory rapid pilot studies that can inform your future work. I'm going to briefly introduce our ecosystem of data, and then I'm going to turn it over to my colleague Karen, who's going to talk more about the data that we have available. So we maintain kind of a multi-level ecosystem of data that really supports our research and ongoing learning partnerships. We have data at the organizational level, and these are things related to the organizations implementing the model in their community, certain policies, their fidelity and quality, their capacity and their goals. We have data at the workforce, so about the parent educators or home visitors who are the trained professionals that are going in the home to work with families, things around their supervision, their staff qualifications, their composition of their staff, and of course, demographics. We have service level data to really understand. I mentioned those 4 components. We have data on services, so how frequently are visits delivered, what's content covered in the visits, getting to the fidelity pieces, screening that you'll hear more about, screening data, and group connections and connection to resources. We have family data, so more demographics about the families, about their stressors, their characteristics, and some family outcomes. And data at the individual level, so both for the child and the caregivers on outcomes and assessments and other demographics. And Karen's gonna now walk us through a little bit more information on some of the individual family and service level data in greater detail.
Thank you, Allison. So I'll introduce myself real quick. I'm Karen Hoerchler, and I'm the Director of Programmatic Data Management here at the Parents as Teachers National Center. And I've been with the National Center for about 10 years. So Parents as Teachers maintains an extensive amount of home visiting data, including service documentation from our data management system. Parents as Teachers affiliates use the system to both plan and document their services to families, capturing numerous demographic, parent, child, and community variables. On your screen are some examples of the data variables contained within the Parents as Teachers data warehouse. So Parents as Teachers began collecting data the family level in 2015. And if you want to advance the next slide, Allison. When we first launched our data management system with the Parents as Teachers data warehouse following a few years later. Recently, in the fall of 2024, we transitioned to a new system and migrated most of our Penelope affiliates at that time. Now that those migrated affiliates have joined the existing users of that new system, we have access to over 70% of all Parents as Teachers affiliate data, which obviously we're really excited about. While there is PAT data collected from as far back as 1998, the bulk of the data within the Parents as Teachers data warehouse really spans a period of about 10 years, from 2015 through today. This is due to the onboarding timeline of affiliates and the past data archival procedures. Moving forward, we will be maintaining all data, though, collected within the data system unless requested otherwise by an affiliate. Included in the data warehouse is data from 1,074 affiliates, which are made up of 11,990 home visitors who did over 5 million visits with 257,659 families. So these families include over 818,000 total individuals, which include 342,452 children and over 280,000 caregivers. Okay, and then if you go on to the next slide. So first, I also wanted to explain a little bit about some of the resources that we have. Given the amount of data held within our data warehouse and the complexity of that data, it's important to help evaluators understand the data that they're exploring. Not only do we answer questions through email and face-to-face meetings, we provide a variety of resources as well, some of which are listed on your screen. So first are the resources that explain the data collected by the Parents as Teachers model. And those are the Data in Motion manual that outlines each of the PAT records, what data is collected in each of those, and then at what frequency. The Outcomes Essential Requirement Guidance outlines what options affiliates have when selecting the parent-child interaction observation tool, along with other optional measures such as depression screening and referrals, IPV screening and referrals, and well-child visits, to name just a few. In addition to these resources, we also have a data dictionary and a data schema for the data system, which helps to outline the various data points held within the data warehouse. And included with each report are a set of inclusion criteria and report definitions specific to that report. An example of what is included for the prenatal postpartum report is on your screen. Currently, we provide data to evaluators through an Excel spreadsheet uploaded to Box. But we're excited to be embarking on a new journey into a web-based reporting platform with real-time access and individualized permission setup. You can see an example of both of those, the Excel version and the new reporting platform on your screen. But for now, only the National Center staff have access to the platform. So we hope to expand that access to other partners in the future. So excited about that as well. So while we've shared a lot of information about the live data available through Parents as Teachers, which has many advantages, it's important to lift up the limitations as well. One of the biggest of which is missing data. So when fields aren't entered into the system, it can lead to gaps in data sets, something that must be considered when analyzing the data. There are also possibilities for data errors when working with live data, and incorrect entries can reduce the accuracy of the data set. Another factor in working with live data is participant variability. Because client-level data is self-reported and engagement can fluctuate, gaps can exist in real-time data there as well. There's also the potential for bias when working with live data, as it may reflect short-term behaviors rather than sustained outcomes. And finally, there are differing program requirements that come into play, as not all programs collect the same data, which can complicate comparisons. So one example of this are depression screening. While it's a required measure for some funding sources like McPhee, it's an optional measure for Parents as Teachers, so not all program to collect that data. And now I'm going to pass it back to Allison.
Thanks, Karen. So now you kind of have a sense of the comprehensive data that we have available, but we also wanted to share a little bit more about ways in which you can engage with our broader network and support other projects. So we have, you heard early on, a network of professionals, and we have the ability to inform future projects. And so that could include in supporting recruitment of affiliates. And so you can engage with them through mass recruitment or a rapid survey. We can also identify and filter from their organizational data to really target the outreach to them. There's many data collection methods beyond the secondary data that we could administer. We have mechanisms to do surveys, interviews, focus groups, or to support your recruitment in that. As well, we've done some system science work like group model building, and also this learning community approach is a peer-to-peer sharing, but also co-creating of solutions. So we are kind of using that as a way to also collect data as well. And want to share, just as we close the loop and try to always translate what we learn back to practice, there's many ways in which we can share and engage with our network. And that can be through email blasts, social media communications. We have monthly and quarterly e-news emails that go out. We do national webinars with our network. We develop briefs, case studies, and can support manuscripts. PatCon is our Parents as Teachers conference that we have annually. This year we had almost 2,100 participants, 1,800 in person, and we have that every year in a different location. It can be a great way to not only share what you're learning, but also get insights and other perspectives. So it can be another way to collect data. We have recently launched a podcast as another way to reach folks. And we're seeing that we've had over 6,000 listens in some of those episodes. So really excited about that. And then I think one of the most important roles of the National Center is we work with our research partners to translate the content into practice. And so that takes the shape of some of our content and our curriculum, some training, implementation guidance to really ultimately serve families and achieve greater outcomes. Did put a save the date on here for our conference in Portland. And there's links here to follow us on some of our social media platforms.